Your teeth affect your whole body. A missing tooth can affect your bite, speech, and eating choices. As you rely on your remaining teeth, you increase the chance they'll wear prematurely or be damaged or lost. You may also experience headaches or jaw pain. Losing a tooth can also hurt your appearance. The good news is that most of the time replacing a missing tooth is not an emergency. You have time to consider what replacement option is best for you and to make an informed decision. If you're missing one or more teeth and choose to have it or them replaced, several treatment options are available. A fragile, temporary, and inexpensive solution is a removable plastic tooth with a plastic retainer, often called a flipper. A less fragile option is a removable partial denture cast in metal and held with wire clips. A fixed bridge is held in place by its neighboring teeth. This requires removing or grinding down the surface of healthy teeth on both sides and placing caps or crowns to support the replacement tooth. In some cases, a Maryland bridge can be cemented to the back of the adjacent teeth. In this case, little or no tooth structure needs to be removed. The most common solution for people missing all teeth in one or both jaws is complete dentures. Some people adapt well to these. Others find them uncomfortable, even intolerable, because of differences in jaw size and shape and their own ability to adapt. Dental implants can be used to replace one tooth or all of an individual's teeth. In many cases, they're used where substantial bone loss has occurred, preventing a comfortable denture fit. When teeth and their roots are lost, the supporting bone is no longer needed, so your body allows it to be lost. Over time, this resorption process affects the fit of a denture. Dental implants safeguard your bone structure, oral health, and appearance. They are artificial root replacement structures placed in the jawbone to provide support for dentures or as anchors for missing teeth. Implant-supported teeth can be cemented, screw-retained, or removable, and can be made attractive, stable, and comfortable for almost any patient. Dental implant treatment is a team approach that includes the patient, the implant surgeon, and the general or restorative dentist. The implant surgeon performs the actual dental implant surgery, but it's the dentist who creates the crowns, bridges, or denture that will be placed over the implants. The team works together, reviewing x-rays, consulting, and determining the number and position of implants in order to plan the most comprehensive treatment possible. Most patients are candidates for dental implants. A thorough dental evaluation, including review of your medical history, will allow us to determine whether an implant-supported restoration is suitable for you. The best way to describe a dental implant is to compare it to a real tooth. A natural tooth consists of a root and a crown. The part of the tooth that you see and eat with is called the crown. Beneath the crown is the root, which anchors the tooth through the gum tissue to the jawbone. When you lose a tooth, you lose both the root and the crown. To replace a tooth, we first have to replace the root. A dental implant is essentially a new root. This titanium root is fitted into a socket that we create in your jaw, replacing the lost root of your natural tooth. Once an implant has been placed in the jaw, the bone around the implant will need to heal for up to 6 months, depending upon how hard the bone is. When this initial phase of healing is completed, a support post, also called an abutment, will be placed into the implant itself, and then a new crown will be made and placed on top. If all of your teeth are missing, a variety of treatment options are available to support the replacement teeth. This office procedure to place a dental implant usually takes about an hour for one implant and usually no more than 2 or 3 hours for multiple implants. The placement process consists of the following steps. If indicated, you'll be given medication prior to the surgery. You may prefer to be sedated using nitrous oxide, frequently called laughing gas, or intravenous medications. Then a local anesthetic will be administered to numb the areas where the implant will be placed. Occasionally, general anesthesia is used, and the patient is not conscious during the surgery. After you're comfortable, a small incision is made into the gum tissue, revealing the bone into which the implant will be placed. Using special instruments, a socket is created carefully, avoiding damage to the bone. The titanium implant is then inserted into the socket. Finally, if necessary, sutures or stitches will be used to close up the gum tissue. After the implant is placed, the area will need to heal for up to 6 months. How long your mouth will need to heal will be determined by a variety of factors. Follow-up care, generally 1 to 4 appointments, is usually needed to ensure that your mouth is healing well and to determine when you're ready for the restorative phase of your treatment. There are a variety of ways that implant placement is finished in preparation for the healing phase. Implants can be placed at the time of extraction, but usually we wait approximately 3 months after tooth loss to place the implant. If the tooth or teeth have been missing for some time, the jawbone becomes smaller. Implant placement can still be accomplished with the occasional need for additional procedures to help build up the jaw. These procedures, referred to as grafting, are usually relatively comfortable and performed in the office. A sinus lift is a grafting procedure which is usually needed when upper back teeth have been missing for some time and the sinus, a hollow space in your upper jaw, has enlarged, causing bone loss. This office procedure is done either before or at the time of implant placement. Most frequently, 1 implant per missing tooth is placed. Because of the pressure exerted by chewing, most back teeth have more than 1 root. Because the teeth in the back of your jaws have 2 or 3 roots, our tendency is to replace missing back teeth with larger implants, or more than 1 implant per tooth. This is especially important if there's been moderate bone loss or if there's evidence of excessive biting force. If you're missing all of the teeth in your lower jaw, you may consider a number of treatment options. Although many patients have no problem wearing an upper denture, some find it difficult to wear lower dentures. The first option is to have 2 implants placed in your lower jaw and a denture made that snaps into these implants. This option allows your lower denture to be more stable while chewing than without implants. This is a viable option if your jaw's support ridge is big enough. There will still be movement of your lower denture, however, and you can still get sore spots if any food particles, especially seeds, are caught under it. As with all removable replacement teeth, you will still need periodic appointments for denture adjustment. A second option involves placing 4 to 6 implants, depending on your jaw size or shape, into your lower jaw. After healing is complete, the implants are connected with a custom-made support bar. Your denture will be made with special retention clips inside that attach onto the support bar, allowing the denture to snap firmly into place. This is called an overdenture. The advantage of this option is that it's much more stable than the first option, allowing very little denture movement. Your denture still will be removable for easy cleaning and maintenance. A third option involves placing 5 or more implants in your jaw and attaching a permanent denture. Your denture is held in place by screws or clasps that secure it to the support posts or bar. It doesn't touch the gum tissue, which allows you to clean under the denture without removing it. This denture will replace all your missing lower teeth and will not be removed except at maintenance visits. Although cleaning under your denture without removing it is more time-consuming and requires more dexterity, many patients who want permanent teeth prefer this option. The final option is to have all your teeth individually replaced so that they will appear to be growing out of your gum tissue and will most closely resemble the appearance of your natural teeth. This option usually requires 8 or more implants. Separate abutments or support posts for each one of these implants will be made, and crowns for each missing tooth will be placed. The teeth are then frequently joined together for strength and support. Overall, this is the most costly option, requires the most implants, and may be limited by the current size and shape of your jawbone. A similar range of treatment options is also available for your upper jaw. However, because the bone is not as hard as that in the lower jaw, people often need more implants to support their replacement teeth. Depending upon the number of implants to be placed, it may be possible to eliminate the need for covering the roof of your mouth with the denture. This option will allow you to better taste your food and to better sense food temperature, and it will make your denture feel more natural. You'll still have a removable denture, which makes cleaning the support bar and denture much easier. If you want a restoration that is similar to your natural teeth and therefore not removable, you probably will need 8 to 10 implants placed. This is followed after healing by the placement of the abutments and crowns. Many options are available, and they're tailored to your specific needs. If you need a replacement tooth while the implants are healing, temporary removable teeth or a temporary bridge can be made. If all your teeth are missing, we can usually modify your present complete denture or make you new temporary dentures. If you would prefer non-removable teeth during the healing phase, temporary transitional implants can usually be placed along with the permanent implants, and temporary teeth may be made and inserted the same day. Although it is natural to be concerned about the pain that may be caused by these procedures, most patients do not experience severe or significant post-operative pain. Pain medication and antibiotics will be prescribed for you to make your recovery as easy as possible. There is a nerve in your lower jaw that can occasionally be irritated during implant placement. This can result in numbness or tingling in your lip, chin, or tongue. Although this numbness will usually resolve, it can be permanent. Notifying us of post-operative numbness as soon as possible will allow us to manage your care in the most appropriate way. Post-operative infections are also possible. We will review with you what to look for in the event an infection develops. These problems will be discussed with you in detail at your surgical consultation and any questions answered. As stated earlier, surgery in our office is usually performed with a combination of local anesthesia and light sedation. Occasionally, general anesthesia is used, and you will not be conscious during surgery. The most common side effect of local anesthesia is a few hours of numbness following surgery. There are additional side effects of light sedation and general anesthesia, which include extended drowsiness, nausea, disorientation, and vomiting. In a small number of cases, allergic reactions to the medications and irritation of the vein where the IV has been placed can occur. This is called phlebitis. Do not eat or drink prior to surgery. This helps to prevent nausea and vomiting during the procedure if light sedation or general anesthesia is to be used. Ask your surgeon for the specific period of time you must not eat or drink. It is important that you be accompanied to the surgery and driven home by a responsible adult. In addition, you must not operate a vehicle or machinery for 24 hours following surgery. Other side effects may also be likely following surgery. These include bleeding, usually for a few hours, swelling of the inside of the mouth and on your face, discomfort, even muscle stiffness in the jaw or joint area. Transitory bruising on the face, lips, and or beneath the sides of the jaw can also occur. Tenderness or cracking at the corners of the mouth may take some time to heal as well.